So the first order of business with the heart, thank you guys for staying with me, is to identify the anterior side. And the anterior side, you will see that the interventricular groove or interventricular sulcus is slanting at an angle from like the top right, from this and then to the bottom left, okay? So so this one is going straight down, so you know it's not the front side of the heart. So the anterior side of the heart is the heart that will be closest to you when you hug somebody. When you hug somebody, that will be the side closest to the chest, right? So this one is sloping at an angle, is it not? Looking here from the top right, from this my right to this. On this side, because it's facing me, this will be the left side of the heart. You see what I'm saying? Do you understand, guys? Yeah. So boom, like that. So this is the anterior interventricular groove or anterior interventricular sulcus, which divides the heart unequally into the left side. And the left side always includes the apex. You see what I'm saying? So this is the left ventricle and this is the right ventricle. Okay? So this is the right auricle and this is the left auricle. Okay? And you can confirm that indeed this is the right side because when you put it into the pulmonary trunk, remember the pulmonary trunk is coming from the so I have to from the right ventricle. You see what I'm saying? So if you put a straight object like a wooden dowel, in this case I'll put my probe in there. I'll be probing and it will hit the right ventricle. You see what I'm saying? So I'm just trying. So unfortunately, sometimes there's all this excess stuff. The thing is, you've got to be sort of patient with it. That's the only thing. I'm so sorry that it kind of takes a bit of doing. See the pulmonary trunk, this one. I'm trying to see where it's gonna go. So sometimes I'd rather use yeah, this is the connective tissue, the fat. The heart will always have a lot of fat surrounding it. There you are. Yes? Did you come back? Thank you so much. I appreciate it. So this will probably be the aorta, and this one will probably... I'm sorry. It's like I did something to you. You see how the this splits into the left and right pulmonary arteries? Ouchie, and look, I tore it off because I'm trying to be fast, and that is no bueno. You see, this one was attached to this. You see, this was a branch of this one right here that I tore off. You see, this one. It was all, you see, this one was coming in like that, and then going in here like that. This is the left and right pulmonary arteries. Okay, so it's going through. You see, I can feel it right here on the right side. You see what I'm saying? So there's definitely the pulmonary trunk, and it's the second thing that you will use to confirm that it is actually the anterior side of the heart. The pulmonary trunk going out at an angle like that, okay? The pulmonary trunk splits into the left and right pulmonary arteries, okay? Very good. Yes, lost a lot of fat. I'm sorry. And this is the aorta right here. Do you see how it's already starting to curve? The aortic arc is going to be starting to curve. Okay. Probably this is the brachiocephalic trunk. It's going to look a little messy for now. You see what I'm saying? The brachiocephalic trunk and then the aortic arc. I tried to rush it, but I also tried to be careful at the same time. So sometimes those things conflict, you know.
I think you're out of frame, Dr.
Thank you. Well, he's talking in technical lingo for the video camera. By the way, you're gonna make a video so that I can use a promotional video.
I'm
for
working
Mark
on it.
Nair. Yeah, okay. I know. Don't worry about it because you got the exams to worry about. Okay.
Yeah.
So good. So now, so this is probably part of the superior vena cava. You see what I'm saying? Because it's on the right side. It's going into the right atrium. This is the right auricle. This is the left auricle. This is the and once we identify the top, the anterior side of the heart, we are going to so the ligamentum teres would be joining the, you see, this is probably where the thing was. The ligamentum teres will be joining, I mean the ductus ligamentum arteriosum would be connecting the aorta to the pulmonary trunk, because it's the one that shunted blood from that had gone into the right ventricle from the pulmonary circulation into the systemic circulation. You see what I'm saying? So that's why you have that connection between the pulmonary trunk and the aorta. You see what I'm saying? Because they're both arteries. So this is the brachiocephalic trunk, and this is the aorta. You see, and you can see the arc doing like that. So if I was to put my dill thingy through here, and then you see, it's gonna go to the left side. Do you see it? Do you see how I put this and it went to the right side? Because that's the pulmonary trunk. And then I put it in the aorta, it's coming from the left ventricle, so it's gonna go here. You see? If you could feel my dowel here, it's like right there. You see? Do you see it? Do you see how it's stabbing in there? Okay. Excellent. I hope I was in frame, but so the second order of business, once we identify the anterior side, is to identify the 4 great blood vessels. Okay? And we've already done it already, starting with the pulmonary trunk. Okay, this is the aorta. And this is the brachiocephalic, trunk, which is the first branch of the aortic arc. Do you see that? And then, because we know this is the right side, so we know that this is probably going to be the superior vena cava, because we know this is the right side. See, the right side is smaller, and then the left side is bigger. And the left side always includes the apex. Even when I cut and I open it, you will see that the left side will include the apex. Okay? So this is the left auricle, there's the right auricle. And then on the left side, you're going to see like 4 pulmonary veins. And normally those ones, you don't see them properly. You just see a whole bunch of stuff going into the left atrium. So this is probably one of the pulmonary veins. Do you see that? So there's 4 of them. 2 from the left and 2 from the right.
So can you not see the anterior vena cava?
Yeah, it's kind of sort of gets cut off a little bit. It's probably, so yeah.
I just didn't see it on the heart.
Yeah. So in terms of the exam, if I'm pointing somewhere close to the right auricle, and I'm talking about what is that blood vessel, you're not gonna say right auricle, right? Because I'm asking about a blood vessel. So you know the blood vessel that goes into the right side of the heart, which will be the vena cava. If you say it's vena cava, I'm okay with it because superior, inferior is some of it is truncated. You never know what's left on that heart. So if you say superior vena cava, I'll still take it. I don't care. Or if you say inferior, I don't care. But just vena cava will be fine. Okay. But in this case, this is superior vena cava. Okay. So that's the thing. And on the left auricle, if I'm pointing somewhere close to the left auricle, you don't really see the veins. Okay. And I'm talking about what's that major blood vessel? And you would have to say pulmonary vein. Do you understand?
Pulmonary vein.
Yeah. And if I point to the same area and I'm saying what's that structure, then you can say left auricle.
So, I have a question. Is auricle and atrium the same thing?
Well, the auricle, you could see it as an extension of the atrium.
Okay.
Because the atrium is a small chamber. Okay.
Okay.
So when the atria are filling up, the auricles balloon up like that.
Okay.
So it's just like an extension, and it looks like a beret, one of those red berets. Prince sang a song like that, and it's stuck on there just to increase the volume of the atria. Okay, so that's what that is. So that's why there's a right auricle, and that's the one that also has those pectinate muscles. When I cut through, you see the pectinate muscles. Okay, and then when I cut through the ventricular myocardium, you'll see the trabecular cani, which are the bigger ridges in the ventricles. Okay, so I'm gonna cut. So you can close it now.